city of Lagos, and this is Health Talk with Bibi, and it's another beautiful Health Saturday where we talk about different health issues. My name is Bibi Chidi, and I will be taking you on Health Talk this morning. But before I go on, I do hope you're having a beautiful Saturday, because as beautiful as the weather is, I'm sure that you are having a beautiful day out there. All right, today on Health Talk, I have compiled a list of the certain kinds of pain that you shouldn't ignore. When I mean certain kinds of pain, at some point in our life, we'll get to feel pain in different parts of our body. We'll get to feel different kinds of pain. But there are certain pain you shouldn't ignore, because these pains might be a sign or signs that something serious, something life-threatening might be wrong with you. And I'm sure that I very well know that in this part of the world, we tend to ignore certain things, especially when it has to do with our health. We ignore pain, we ignore a lot of things about health, because I think it is because of the economic situation in the country, or some people might say it is because it's not our culture, or it is not a necessary practice that we inculcate in our system. And so it all boils down to not having enough to eat and then having another one to budget for health. Okay, but in all we do, we should know that the health of someone comes first, because health, they say, is wealth. It is only when you're healthy that you can find yourself doing things you love. You can find yourself doing certain things that you enjoy. You can even find yourself making money. But if you're not healthy, definitely you won't do all of those things. And that is also the reason I have made this compilation for you. There are these certain things in some parts of your body that when it affects you, you should call your doctor immediately. I mean, ASAP. You shouldn't ignore them, because they might be communicating with you that something serious is wrong with you. And only a medical diagnosis will reveal or identify what the problem is. So pain actually is a personal thing. The way I feel is not the way you feel. If something happens to me, maybe a minor injury, I trip and fell, and the severity of my pain might be different from your severity. It might strike me in different places, and it might not strike you in different places. For me, it might be less intense. For you, it might be more intense. For me, it might end quickly. For you, it might persist for days. For the way we feel pain, the severity of the pain differs in body systems. So what you feel might be different from what I feel, even when we're having the same problem. There are certain kind of pains that typically signal serious problems that need medical attention, and ignoring such pain might be very life-threatening. I know that you wouldn't want to ignore such pain. First on my list is severe abdominal pain. When you have severe abdominal pain, the possible issue might be appendicitis or acute pancreatitis. Pain in the abdomen is common and can have a number of causes, including just ordinary gas. But when that pain becomes very sudden, it becomes intense, that it moves to the lower right of your abdomen and gets worse over a few hours. It could be appendicitis. And I tell you, you may be needing an emergency surgery to remove your inflamed appendix before it bursts. And when it bursts, it becomes a life-threatening situation. If you and I have seen someone who have been there before, someone who has experienced such appendicitis issue, the pain that comes with it is usually very intense. You see them, they can't stand straight, they will bend and hold their stomach. That's their lower right of the abdomen. They can't stand erect because of the kind of pain they are feeling. So if a pain is sharp in your upper middle abdomen and radiates to your back, you also have fever or vomiting. You see that the pain is moving from your middle abdomen right to your back, and it accompanies fever is accompanied with it, and vomiting as well. That could mean acute pancreatitis. So you need to find your way to the hospital immediately to see your doctor. And remember, it is only a medical diagnosis that can rule out whatever your problem is, or that can tell you, identify that this is your problem and this is not the problem. All right. And you should also know that pancreatitis can be caused by gallstones that should be removed, and early detection might help you avoid using surgery in removing them. So in all of the health problems that we face, I keep saying that early detection is key. Even your medical professionals will tell you that early detection is key, because when you detect it early, there's a possibility that your problem will be solved or will be managed properly. Now, there are some people that experience headache. Headache comes in different forms. When you experience a kind of headache that you've not experienced before, it is different from normally what happens to you. There are possible issues that might be wrong with you. It might be brain aneurysm, it might be stroke, it might be carbon monoxide poisoning. So look out for these three things when you experience any headache that is different from what you normally experience. In fact, it is way different. It is not the usual kind of thing that you experience. So look out for it. And people usually worry that sudden headache could be a sign of brain tumor, but it's not all the time that a sudden headache might be a sign of brain tumor. Not all the time. But it might be difficult for you to distinguish which is a brain tumor and which is a carbon monoxide poison and which is a stroke or brain aneurysm. So if you have a headache that's out of the ordinary, that is not the usual headache that you normally have, there's you should seek medical help. There's need for you to see your doctor. All right, you have to get checked. Emergency medical professionals want to check you to rule out that it is not a life-threatening condition such as stroke. And whenever a stroke occurs in someone, the doctor usually send you for brain scan to rule out the fact that there's a bleeding in the brain. Because when there's a burst aneurysm, it usually causes bleeding in the brain as a result of a weakened blood vessel. So when you have such headache that is not the usual one that you experience from time to time, there's need for you to check with your doctor to ensure that it is not a stroke, it is not brain aneurysm, it is not carbon monoxide poisoning. So he will be in the best position to rule out all these options. Then there are some other culprits for such headache that is not the usual headache you experience. It could come from infection like meningitis, and there are also things that might not be associated with headache like glaucoma and this carbon monoxide poisoning. So it is a doctor that will tell you, okay, your headache is being caused by this or that. So you get sure. Then another pain I also compared here is lower back pain coupled with fever. When you, in fact, this is very personal to me. This lower back pain coupled with fever is very personal to me because someone very, very close to me had a kidney issue, and before we realized it was a kidney issue, she was complaining of severe lower back pain, that she finds it difficult to walk a distance. She walk from here to there, and then she's looking for a place to sit down. It accompanies fever sometimes. All this, we're actually trying to get her to scan, to check what the problem is, go for x-ray to check what the problem is. And it was when we went for x-ray that we realized it was a kidney infection and not anything associated with bone at all. So sometimes when you have a kidney infection, you might start up as lower back pain, and then it will associate with fever. Fever comes along with it. So rule out kidney infection. So if you're feverish and you have this back pain and tenderness between your ribs and your hip, you might have a kidney infection. There are also other symptoms, and other symptoms include painful urination. When you're trying to, pee, it's very painful for you, and you feel like you're not done peeing. And also sometimes you can also vomit. All right. So when you have these ones, you need to get yourself checked, because untreated kidney infections can be very, very life-threatening. It will get to its worst stage. So you need to see your doctor. But the good news is that if you have a kidney infection that has not degenerated, that has not gotten to its worst stage, antibiotics can actually help you to prevent getting to that severe stage. Your doctor will prescribe antibiotics for you, which will cure the infection before it gets to that worst stage. Okay, so that's for lower back pain. And another one I want to talk about is chest pain. There are some people, when they're having chest pain, they will just hit their chest back, like it will go. Some people will tell themselves, it's warm, I'm having warm. This is happening to me as a result of warm. It's not usually all the time. If you suspect or if you feel like an elephant, something heavy is on your chest, like an elephant is sitting on your chest, like something heavy is on your chest, please suspect a heart attack. It usually starts out like that. It feels like something heavy is on your chest, for some women and for some people who have diabetes, it could be very subtle, like make you not to feel anything, make you not to notice it on time. And it comes with vomiting, it comes with shortness of breath, it comes with pain in the back, pain in the jaw, pain in the neck, or even the shoulders. So excuse me. So when you notice something heavy on your chest accompanied with all these things I listed, vomiting, shortness of breath, pain in the back, pain in the jaw, pain in the shoulders and the neck, then you need to go to the hospital ASAP, as fast as possible. Because if it is heart attack, and it has not attacked you, doctors might do something about it. So chest pain is one thing people tend to put off, but they shouldn't put it off because it is very, very severe. Once you have a chest pain, even if it comes and you feel there's something heavy on your chest, then you don't feel all of these ones that I listed, please find yourself to the hospital. Get yourself as quickly as possible to the nearest hospital. Can be saving your own life. All right, then another pain I documented is pain in one calf. It might be a deep vein thrombosis. A deep vein thrombosis. When you sit for too long, let's say when you're on transit, when you're traveling, when you're on a journey, some people can actually sit for let's say 9 hours, 10 hours, 8 hours, 7 hours, as the case may be. So when you sit for that long, it can actually lead to a blood clot or forming, or blood clot forming in one calf or in one of your thigh. And the clot, or deep vein thrombosis as it may be called, may start small. The pain may start small. Sometimes it will not even show you any symptoms at all. But as it continues, it causes severe pain. And sometimes it becomes warm and tender. The place becomes warm and tender. So when you notice this, you do not have to ignore it. You don't need to ignore it. You need to get yourself to the hospital and get yourself checked. Because when you notice these symptoms, it could be that deep vein thrombosis, or if you're not sure, it could be that. Then when you get to the hospital, the doctor will check you and see if it is the what you're having or not. So if the clot breaks loose and enters your bloodstream, it can actually lodge in your lungs and keep oxygen from reaching your brain. And when oxygen doesn't get to your brain, my brother, I tell you, it is a life-threatening situation. It can be fatal, very fatal. So when you notice such pain in one of your calf, you need to find yourself in the hospital so that the doctor might can check you and tell you what your problem is. And if it is a minor thing, it is only the medical doctor that can tell you. If it is a serious issue, it is still only the medical doctor can check you. Do not ignore any pain at all. Then when you have a searing pain in your big toe, your big toe now, when you have a searing pain in that area, it is the possible issue might be gout. And gout is one of the most painful forms of arthritis. Very, very painful. It is caused by a buildup of uric acid crystals in the joint. This acid is a byproduct of digesting certain foods, such foods like red meat, like alcohol, and items containing high fructose syrup, like soft drink, your minerals, and sweets, your candy, and all of those things. Though this gout might start off with your big toe, then it will start spreading to other joints as well. So look out, and if you notice such searing pain in your big toe, you need to get yourself checked immediately. And one thing is that sometimes when you notice this early, over-the-counter non-steroidal anti-inflammatory drugs might bring you relief. It might help you and you'll be fine. But you still need to see your doctor. Because when your doctor checks you and say, okay, I think it is an arthritis, the doctor is in a better position to prescribe the proper drugs for you and to also treat you. And know that untreated gout raises the risk for kidney stones and chronic kidney failure. So if you ignore it, if you see it as just ordinary pain, my daughter, bring a rub for me. You apply balm, you apply aboniki, you do this one. If you keep ignoring it, it might raise the risk for kidney stones and chronic kidney failure. And if you have seen someone who is affected by kidney failure, you wouldn't, or kidney stone rather, wouldn't want to experience it, because it is better imagined than experienced. Okay, if you even want to imagine it or know how it feels like, and actually take yourself to the hospital, look here, and go to their section. When you look at people having kidney problems, you will come back and tell yourself, yes, it is better imagined than experienced. So when you have any pain in any part of your body, do not ignore it, because if you ignore it, you might be putting yourself in a very life-threatening and risky situation. Then another one for women, for ladies, my ladies, is menstrual cramps that doesn't go away. When you have menstrual cramps and you take pain reliever, the pain is expected to go away. All right, after taking the medication, is expected to go away. But then you see yourself still having the cramps after taking your medication. You're still complaining. It is severe. It is serious, and all of that. There's a possible issue that what is wrong with you is called endometriosis. Endometriosis. When a woman have pelvic pain, gynecological causes are probably top of the list, and that top of the list is endometriosis, where tissue from the lining of the uterus grows outside the uterus, and it is very painful. Okay, so you need to get yourself to the hospital to see a gynecologist, because the gynecologist will check you and rule out if it is ordinary menstrual cramps or endometriosis. Your doctor is going to do a full exam to rule out issues such as non-cancerous uterine tumors. Okay, so when your doctor checks you, your doctor will know if you have cancerous uterine tumors or non-cancerous uterine tumors. If you have STDs or if you don't have STDs, or if you have ovarian cancer or not. So when he checks this and you are free and it's just menstrual cramp, the doctor will also prescribe drugs that will help you. And even if it is these issues that I mentioned that are wrong with you, don't worry, trust your medical professional. Your medical doctor will give you treatment that will help you. At least for some time, the pain will go away and before you start your treatment. And some people, hormone therapy can also, cause certain things they go through during their menstrual period or menstruation or whatever you call it. All right, endometriosis sometimes leads to infertility, and that is why when you have such cramps, when you notice such pain, you don't have to close your eyes to it and say, after my period, after 4 days, after 5 days, it will go away. No, don't think like that. Take yourself to the hospital, because it might cause infertility. If you leave it untreated, it might cause infertility. But sometimes invasive surgery will help you. When a doctor, does invasive surgery to remove the endometrial tissue, it can help some women conceive. So if you notice any pain, do not ignore it, because it might be life-threatening. And if you are a woman who is past childbearing age, hysterectomy might be the cure for you. Then, this one, I've talked about ladies when they are going through menstrual cramps, the pain that comes with menstrual cramps. Then for the men, painful urination in men, a possible issue is sexually transmitted disease, STD. So if you are a man and you notice pain when you're trying to pee, a burning or tingling pain during or right after urinating, it can be a sign that you have a sexually transmitted disease. So painful urination is often the only symptom of gonorrhea in men, so you need to get yourself checked. Untreated gonorrhea can lead to complications. You should know that one, such as infection around the anus or loss of fertility. It can also lead to infertility in men, and it can spread to blood or joints. That's in rare cases. It becomes a life-threatening situation. But the good thing is that gonorrhea is curable with antibiotics, so your doctor will prescribe that for you. When getting treatment, men should make sure they are also screened for some other sexually transmitted diseases to rule out that they are not having this issue. Okay, so I hope you got value, and I hope that when next you notice pain in your body, whichever part of the body it is, you do not have to ignore it, but rather get yourself treated, get yourself checked, and that you can only do by going to the hospital to get yourself checked, and the doctor will prescribe the adequate treatment for you. All right, that is it on Health Talk with Bibi this Saturday morning. I will come your way next week and same time when I bring another health issue your way. My name still remains Biblas Chidi, or Bibi, here on Voice of the People, 90.3 FM.
the perfect getaway?
Look no further than the luxurious accommodations at Airport Golden Tulip Hotel.